Hello, everyone, and welcome back to Spartan Pulse. I'm Taylor Myers.
And I'm Terrance, Lindsey, and we hope that you enjoyed their wellness days last week, and we hope you had a wonderful weekend. Taylor, can you tell me a little about what do you do for your wellness days last week?
So last week, I actually went home and kind of hung out with my parents for a little bit, which was nice. And then I just kind of caught up on some stuff I had to get done, like grocery shopping, clean my house. So the not so fun stuff. What about you, Terrance? What did you do over your wellness days?
Yeah, I had to study for an exam that was that coming Friday. So I just basically prepared for that and went to work, and then relax. I watched the movie to not do too much, but it was kind of relaxing.
Well, that's good. You at least got a movie in. So this week we're going to talk a little bit about clinical experiences within the College of Nursing. So Terrence, why don't you tell me a little bit about your first clinical experience and how that went for you?
Yes, my first clinical experience was at a long-term care facility. And going into there, it was like we didn't know what to expect. We all was meeting up in a debrief room, and we was getting report on the patient from my clinical instructor. I remember we was nervous, and like when they was eating, she was like, "Go get meet yourself, go introduce yourself," and we were all like nervous, but it all worked out pretty good. The residents there, they were very nice and understanding. They knew we were new nursing students because they said previously they always get new nursing students. And so it was very comforting to be able to talk to them and conversate while they eating breakfast. So it wasn't a bad clinical experience. It was actually nice.
Yeah, for me, I feel like with the clinical instructors, they're very aware of where you are in the program. And for the first year ones, they know that it's all new and scary. So they're really willing to help you along. But the later you get into the program, I think they are a bit more they'll let you do what you need to do and but they're also there to help you, which I think is good because it kind of gives you a better sense of confidence with someone not always right there, watching your every move. So, but they're always there to help if you need it too. Have you had a similar experience with that with your clinical instructors, as you've moved through the program?
Oh, yes, as I moved through the program, I think my clinical instructors had higher expectations every time.
Yeah.
But it's a good high expectation. It really pushes you to the limit to really think about what's next and what you can actually do more and get better at your assessment skills or a little bit of safety protocols that you should know. But they did a little more flexibility and they open to questions, any type of question do you have, and try to decrease that anxiety as much as possible. So it was nice.
Really, and I think another scary thing going into the hospital clinical the first time was you get there and then it's time for report right away normally. So report is when you do the night shift nurse leaves and the day shift comes on or vice versa. And when the student's there, you get assigned to a patient normally in your first clinical, or you're in a partnership with another nursing student and you get assigned one patient. So you find the nurse who's going to get that patient and you kind of get report with them. So you write down any notes that the shift nurse has to give you. So you want to write down code status, allergies, just that bullet information in that. And then you can look at the computer if you feel like you need a little bit more information. Normally they use what's called SBAR, which is situation, background, assessment, and recommendations for a report, which if you're in the college of nursing, you're very familiar with it. If you're coming in, you will become very familiar with it and you'll never ever forget it again. Um, Terrence, can you tell me a little bit about how you take report and think key things that you take out with it?
Yeah, definitely. I think report is the main, the vital, like the baseline of what it's like an interview before you get into anything. I think it's like the baseline of how your patient's gonna last and what the different protocols you should look out for and what they miss, what they haven't missed, what to look for. As you mentioned, safety protocols is very important. The cold status, is they on antiplatelets? What do you look out for? What is their condition? They meds? How do they deal with their meds? Any side effects? And then, yeah, that's rerouting the S bar. S bar is so important. And it makes you a stronger thinker, honestly. I love the assessment part. And so, what am I doing on my objective information? What am I assessing for? What am I listening to? Am I oxygenating the lungs, looking for certain crackles or wheezing or anything that's abnormal? And I'm reporting it to the nurse. So those assessment sign and S-bar is really good in terms of communication and the barriers that we should bridge to make a better effectiveness for this patient. So I think it's important.
Yeah, and it can also help you learn, like, especially like when you're learning how to like listen to lungs and listen to heart sounds. Like if they say, "Oh, he has a murmur," then like you're listening for that, and you would maybe learn that, "Oh, okay, this is what it sounds like." And I think that was like helpful for me with like lung sounds. Of they said, "Oh, he's got like crackles in the bases or whatever." And then you can go and listen, you're like, oh, okay, like I can see how that sounds a little different than in the lab when they play it over the like computer or whatever.
So Taylor, how did your clinical experience help shape you? Well, we're not nurses yet, but how do you feel like it's preparing you to become a nurse or a better nurse?
Yeah, so definitely when you get to your like preceptorship, I feel like I kind of feel like I am a nurse now. Like I obviously am not. But I am confident in what I'm doing. My preceptor's there to help me, but she, you know, lets me do what I think is going to be right, and then she corrects if that's not the best way to go about something. So it all builds up to that, and when you get to that, I think it really sets in for a lot of people that like, wow, like I actually know what I'm doing, and the confidence really builds that last semester. So I hope other people have that similar experience with it, and that's not just me, but
Yeah.
like your confidence builds throughout it, and then once you get to the end, you should feel at least comfortable with it. Maybe not confident in taking care of every kind of patient, but comfortable with your skill set, definitely.
Yeah, thank you, Taylor. I think our clinical experience is what makes us who we are, and as we go on, we will progress. And so we do have news for you today. And the first one is Give Green Day is almost a week away. Support the cost of the College of Nursing Pen for our BSN graduates through the Pen Pal program. The program will support the costs associated with the pending of our BSN graduates while linking donors to our newest Spartan nurses in a meaningful way. We are asking for a donation of $60, which will cover the cost of the traditional pen for our graduates. Because of this program, BSN graduates will receive their MSU College of Nursing pen for free of charge. Learn more about this by clicking to the link below, and we will have that for you.
Also, this Wednesday, the MSU College of Nursing is hosting a spring information day from 5 to 6:30 p.m. Through this virtual event, you can meet with students, faculty, and staff and learn which program is right for you. If you have any questions that you haven't answered, please join the event. You can register for the event by going to the College of Nursing website and clicking on events.
And as always, please comment about any questions you may have. We're happy to answer any questions and possibly even an episode that we should represent on, any topics, any discussion that you want to do. And we are here to discuss those.
Thank you guys so much for watching. This wraps up this week's episode of Spartan Pulse. I'm Taylor Myers.
And I'm Terrance Lindsey. And don't forget to follow us on all social media platforms. And have a good week. Thank you.